If you have had a relapse, understand that this isn't the end. There is still every amount of intervention available to you. You're not a failure.
One of the most frustrating parts of starting to break free from alcohol or drug dependence is having to start over because of a relapse. But at INSynergy, a St. Louis-based alcohol and drug treatment program, relapses are not seen as failures, but rather as opportunities.
The goal is that you're able to pick yourself up, identify and learn from what that relapse has caused. Where did it come from? What were the triggering factors? Was it environmental? Was it medication? Was it mood? And learn from it and move forward.
When it comes to alcohol, studies have found a relapse rate as high as 80% during the first year after treatment. For opioids, the likelihood of relapse can be as high as 95% after the first year of treatment. But those are national averages. At INSynergy, patients beat the averages because the approach here utilizes highly personalized, medically based solutions.
We treat addiction like any other chronic medical illness. We do genetic testing that can give us some insight to which medicines may be helpful and may not be helpful. We screen for other medical conditions like anemia or hypothyroid or vitamin deficiencies or hormone deficiencies like testosterone or things like that. These are easy things that we can identify. Our interventions are designed to prevent an early death.
INSynergy's success at limiting the frequency of relapses also comes from offering patients anti-craving medications like Vivitrol and the use of FDA-cleared neuromodulation devices, which send faint electrical pulses to particular nerves related to the unpleasant side effects of opiate withdrawal.
The benefit of a comprehensive treatment program is that we can really give control back to the patient instead of the addiction and really challenge your thought process to allow that to occur.
Whether it's a medical condition, genetics, social pressure, or just boredom that leads patients to fall back on old habits, the important thing to remember is that relapses are not a break from the process. They are part of the process.
Life is trying to teach you lots of things, and it's important to listen. And relapse is certainly one of those. It doesn't have to be this failure, this shameful event.
Just like a symphony, the brain has different sections, and we're dependent on these sections to be perfectly in tune. With relapse, a lot of things are out of tune. We can fix it with time, with the proper understanding of the brain and the rhythms of the brain. All the sections in the brain can eventually make beautiful music together.
For more information about INSynergy, including a no-obligation free individual assessment, go to INSynergySTL.com. Reporting for INSynergy, I'm Paul Shankman, Story Smart.